Our final speaker this morning is Dr. Carrie Byington, who will present on infection control of Olympic proportions. Dr. Byington is Associate Vice President for Faculty and Academic Affairs at the University of Utah and is the Director of several career development programs in pediatrics. Dr. Byington has mentored over 90 trainees and junior faculty. Her research has focused on viral and bacterial infections in infants and children. Please join me in welcoming Dr. Carrie Byington.
Thank you very much. It's an extraordinary privilege to be here in front of you today. When the Academy called, they asked if I would come and talk about an experience that was really one of a lifetime for me. And I hope that those of you who have been attending this meeting this time and in the past recognize that these experiences are open to all of us as pediatricians just through our chosen career. Anything that we're able to do to improve the life of a child betters us all. So I'm happy to talk about this experience, which is really addressing Zika virus, which was a public health emergency of Olympic proportions. I have a small disclosure. And my objectives today are really to talk about how the Academy helped to prepare me for this leadership role that was really a leadership role that was unexpected, and how work in the Academy helped to train me, and I hope that some of this will be useful to young people in the audience as you think about your own careers. I am a little bit of a storyteller, and I always have to start at the beginning. And for me, the beginning of this adventure was really in 1988, when I was a medical student. I had the privilege of training at Baylor College of Medicine, and I had the extreme privilege and good fortune of being mentored by Dr. Ralph Feigen, someone that many of you in this audience will know. So in 1988, I was a medical student, and Dr. Feigen asked me my plans. I said that I intended to study infectious diseases, and I intended to join the Peace Corps after my residency was completed. He said to me, "Carrie, you want to be in the Peace Corps because you want to make a difference." And I said, "Yes, that's right. I want to make a difference." And he said these words that I've never forgotten. He said, "Carrie, you change the lives of children through research." I had never considered that. I had never understood that. And he planted a seed that day that really changed my life. He said, if you are able to do research and the research is good enough, then it will end up here in the Red Book. And it will change the way that people treat children. And that's the way you make a difference. So in 1988, that conversation really changed the trajectory of my career and of my life. And research became very important to me. So I went through my pediatric residency, which I completed in 1992. I completed that at Baylor, and then I did an infectious disease fellowship at University of California, San Francisco, and joined the academic ranks of the University of Utah in 1995. And I went through the traditional ranks of assistant, associate, full professor, having a very I would say fulfilling professional career with the opportunity to teach, the opportunity to do research, and the opportunity to serve patients. In 2005, I was feeling as a full professor that I had accomplished many of the things that I wanted to accomplish in my own institution, and was there a way for me to contribute more on a national level and to do things for children in a different way? So I talked with my mentors, and they really rallied around me, as my chapter did as well. And I was able to really express to people that this secret desire that I had had since 1988 to be a member of the Committee on Infectious Diseases, to be part of the Red Book Committee. It was hard for me to say it because it meant so much, and I felt like I couldn't possibly be worthy to be on that committee. And so it was difficult to express it to my mentors, but they did rally around me, and we put in an application, and lo and behold, I was here in 2008 at my first Meet the Red Book session. This was an incredible moment of professional fulfillment for me. I hope you can see that smile on my face. And I was thinking about Dr. Feigen the whole time and felt that I had really reached the highest pinnacle that I could ever reach in my career, and was extremely pleased to be there. So what are some of the benefits of being on an AAP committee? For me, it was the national focus, being able to look at the big picture and the big issues for children within my specialty. I've now had the opportunity to write about 40 policy statements for the Academy that have to do with infectious diseases. These are policy statements that I hope you all are using. I see my own partners using them all the time. I had an email just yesterday from one of my partners about the new recommendation for HPV vaccine, and she said, "What should we do?" And it's like, here it is. I just finished writing the policy statement. So it's a great opportunity to work on a national level. It increases your knowledge dramatically. One of the things that I would love to do is see CME support for those who participate on committees, because you grow in knowledge so much. We get to hear data before it's published. We get to hear data before it's presented at national meetings. We get to interact with the CDC, NIH, the FDA, all of the players that can actually change policy for children. Of course, it's an incredible opportunity for leadership development as you work with these institutions. The annual leadership forum is a place where you can be trained in leadership development, but I would say it's the day-to-day work of the committee that your leadership really develops. You have to listen to differing opinions and perspectives from all over the country and find a way to bring people together into an understanding that can move forward in a mutually beneficial way, always remembering that it's the child that you have to support first. It's great for networking, and it's great for media training. You have to stand up in front of large groups of people like I'm having to do right now. So for me, the biggest area I would say of knowledge development that I've had over the last 8 years has been in addressing emerging infections. This slide is just a small snapshot of the infections that we've had to deal with through the Committee on Infectious Diseases just since I've been a member. Right after I joined, of course, we had the H1N1 pandemic, which was a crippling pandemic. It changed everything in our hospitals, in our practices, in the way we immunize children and pregnant women. We learned so much during that pandemic. We've also dealt with MERS and SARS and avian influenza, dengue, chikungunya, most recently, of course, Zika, enterovirus D68 with acute flaccid myelitis, and of course, the big one in the middle, Ebola. Ebola, for me, I would say, was transformational. So dealing with emergent infections, there are many things that you have to learn. You have to develop comfort with uncertainty. You have to be able to respond incredibly quickly, even when certainty is not possible. You have to design clear communication strategies, what is known and especially what is not known, because those are the places that the work needs to be done. And you need to be able to network with AAP, media relations, chapters, CDC to get that consistent and unified message out. I really felt the weight of this with the Ebola epidemic. I became the chair of the Committee on Infectious Diseases on July 1st of 2014. That's my birthday. I'm an academic physician, so big things always happen on July 1st. Of course, we were in the midst of learning about Ebola, and by the time of my first NCE and my first time to lead the Meet the Red Book session, October of 2014, there were lots of fears and questions and uncertainty about Ebola. It had come into the United States, and what were we going to do? By that time, I had been to several Meet the Red Book sessions, but I had never been to one like this. The room was packed, and it was decided, since I was the chair, I had to address Ebola, and I had to answer people's questions. You could have heard a pin drop in that room. I have never seen such a packed room so silent. And I realized that they were waiting for the words that were going to come out of my mouth. I had never been to Africa. I had never seen a case of Ebola. I felt incredibly small trying to address their questions. But I felt some confidence by having the weight of the Academy behind me and the work that we had done with the CDC to try to prepare for this moment. Nevertheless, it was overwhelming. And that was on October the 13th. And on the 14th, this statement was published in the AAP News. When I finished talking at Meet the Red Book, the Academy leadership came up to me and said, "We need you to write something tomorrow. It needs to be published by tomorrow." This is not a journal article. This is an AAP News article. Yet it captured so much media attention, and people wrote to me from all over the world to try to address and begin to address the needs of children during the Ebola epidemic. So I would say this is one of the most influential things I was able to do with the help of the Academy. So now, fast forward, and we're in 2016. It's an Olympic year. Of course, the Olympic cities are picked years in advance. As fate would have it, the Summer Olympics would take place in Rio de Janeiro, which also happened to be the epicenter of the Zika outbreak. And as pediatricians, you know that the Zika outbreak was having a disproportionate effect on pregnant women and children. And so the United States Olympic Committee put out a call for infectious disease specialists. This doesn't happen very often. And it doesn't happen in USA Today. So this was USA Today in February of 2016, really a calling all ID specialists who can help us. The only job description in this ad was that they wanted a woman infectious disease physician so that she could talk with the women athletes, coaches, and staff who were expressing reservations about traveling to Brazil at that time. Well, I'm a woman. So this is where the media training comes in. And you know, being chair of the Committee on Infectious Diseases, there's pretty much no one in the ID community that I don't know, adult or pediatric trained. And so many people have called me and said, "How did you get this gig? Why was it you? You're not a flavivirus expert." Well, no kidding, who is a flavivirus expert? And so this is how I got this gig. I created my message. I found a way to meet with the chief medical officer of the U.S. Olympic Committee, and I talked to him for about 2 hours, explaining why I felt I was qualified. I was a woman, as I had said. I had infectious disease expertise, particularly infections with infants and congenital and perinatal infections. In my practice of infectious diseases, and more importantly in my practice of general pediatrics, I counsel pregnant women every day who are facing concerning diagnoses. I had expertise in developing diagnostic technology. I had a leadership role in the Committee on Infectious Diseases, and I was networking frequently with CDC to develop guidance. All of those are great, and all of those are important. But I think what really did it was that I could convey to them that I came from an Olympic city. Salt Lake City hosted the Olympic Games in 2002. Many of you will remember that those games happened right after the 9/11 attacks. And the anthrax bioterror attacks were on everyone's mind. So protecting this city and the Olympic athletes and visitors who came to this city from an infectious disease threat was something that I knew about and had experience with. And I think it was this that made them choose me over perhaps an adult infectious disease doctor, which I kind of thought they should pick. But it helped them to choose me. And so in March, I was announced as the chair of the first infectious disease advisory group for the U.S. Olympic Committee. This was an incredible honor and an incredible responsibility. Our primary goal was to counsel those who were going to be traveling to the Olympic Games and to help them prevent Zika virus infection. I was able to do that and personally counseled with my team over 1,700 individuals who were going to go to the Olympics. It was an amazing experience for me to hear their stories, to hear their fears and their concerns, and to help give them information as updated as possible to keep them safe and to protect their reproductive health. That was an important role and an important goal, but I knew that we could also do more. As a clinician, I had met my duty to my patients, but as a scientist, I knew that we could not let this opportunity pass for research. So working to convince the United States Olympic Committee that they needed to be involved in research, that they needed to participate in helping us identify the answers to the unknowns of the Zika virus, that I feel was the best contribution that I made to the Games. And so we were able to work together to convince the USOC, to convince the NIH and the CDC, and on July 1st, I received funding to study the Zika virus amongst the Olympic athletes. It was especially important for me to do this because it was a time when people were really talking about what's called parachute research, where investigators drop in to a developing country, get what they need, and get out without the developing population receiving much benefit. This was exactly the opposite. This was an elite and privileged group of individuals who were going to go into Brazil, and they were going to serve as the research subjects in order to answer questions that would be important for all the countries in the Americas facing Zika virus. So, although everyone felt and thought I spent my whole summer in Rio, I did not. I spent it in Houston, Texas, in a convention center, much like this convention center. And so Houston, Texas welcomed Team USA, and they also welcomed Team Zika from the University of Utah. These are some of the athletes and some of the coaches and some of the young people that I was able to bring with me and mentor through this research experience, which was amazing. We were primarily studying the Zika virus transmission in the pregnant woman and through perinatal transmission and through sexual transmission. These were quite remarkable findings for an arbovirus and something that we're still actively studying. Our NIH study had 3 aims. I don't expect you to read them, but basically the first aim was to test 1,000 people, which we are in the midst of doing right now. And for those who are positive, we will continue to test them until they clear the Zika virus from their system. We are testing both men and women. We're testing all body fluids that you can conceive of, and this information will be incredibly important as people try to plan their pregnancies after Zika exposure. And then finally, as a pediatrician, we're evaluating the outcomes of pregnancy, including the developmental outcomes of any children that may be born following the Games. So we were able to enroll 963 travelers to Rio, and half men, half women. We know that approximately 25% of them wish to become pregnant in this year following the Olympic Games, and we know that 19 participants went either pregnant or had a pregnant partner at home. We expect about 30 to 50 of our participants to be infected with the Zika virus, and we will monitor them closely for the next 2 years. And those individuals will submit body fluids monthly, and we will validate new technology for those body fluids. We expect to learn how long the virus persists in body fluids and look at differences between symptomatic and asymptomatic individuals. We have an opportunity to look at transmission between partners, and we will capture reproductive outcomes, including fertility after infection, pregnancy outcomes, and outcomes of infants at birth and at 1 year. There's so much more to do, and I hope that this will just be a springboard to an even larger study to the developmental outcomes of infants who are infected or exposed to the Zika virus in utero. So that was my summer, and in summary, I'd really like to say that this is an opportunity for all of you to mentor others to participate in AAP committees. And through your participation in these committees, develop your own knowledge and leadership experience, and leverage your AAP experience to serve others nationally. We have that opportunity every day. Thank you very much.